morning students. So today we are going to see the CPR over here. This is a simulation lab. My name is Hussain Nadab, Assistant Professor, Symbiosis College of Nursing. Okay. So before studying the CPR, you should know certain points. So first one is, what is CPR? CPR is nothing but the Cardiopulmonary Resuscitation. Why it is called as Cardiopulmonary Resuscitation? The name itself says cardio means heart, pulmonary means lungs, and resuscitation is nothing but a revival of the heart. In the case of revival, whenever I say revival in the case of, there are certain indications. In the case revival, the person is having a cardiac arrest, the person is having a respiratory arrest. In the case of drowning, in the case of snake bite, and in the case of sudden fall of the patient. It can be anything. You don't know the exact cause. And the contraindication is only one contraindication we are going to discuss here, that is DNR. DNR is nothing but do not resuscitate. In the case whenever the patient relative has given the consent not to resuscitate, in that case only we are not going to resuscitate the patient. Okay, you can see these are the contraindications. Now this is a scenario, we have already plotted the scenario. So consider this is a patient which has been collapsed or fall. Okay, so first we have to assess the patient scenario and the patient what we can say surroundings. We have to check the surroundings and the patient. The patient, we have to tap the patient. Okay, hello, are you okay? Hello, are you okay? The person has collapsed and we don't know what is the cause behind this collapse. So we are going to tap. If the patient is not responding, if the patient is not breathing, we have to do three things. That is look, listen and feel. Okay, na? So we have to go close near to the patient. We have to look for the patient, okay, na? And listen for the breathing sounds. Okay, na? So this thing we have to do it simultaneously. Okay. So I am listening for the breath sounds. I am feeling for the breath sounds. So there should be a blow over your cheeks. If you are near to this patient like this, patient is not having breath, I am not able to see the chest rise and fall. We have to see the chest rise and fall. This is nothing but the look of the chest rise and fall, and listen for the breath sounds or the feel for the breath sounds. Okay, then what you have to the feel is another thing. You have to see for the carotid pulse. For checking the carotid pulse, you're gonna feel this throat, and at the side of the lateral side of the throat you are going to feel the carotid pulse. Why we have to check the carotid pulse? Because carotid pulse is near to the heart. It is not above the peripheries. A radial goes to the peripheries, which is away from the heart, and this is the central one, which is closer to the heart. We have to check the carotid pulse. Okay, yes, if the patient is being collapsed, somewhat pulsation you will feel in that case. If you are not able to if the look, listen, feel is not there, if you are not chest rise and fall is not there, you are not able to feel the carotid pulse, you are not able to hear the breath sounds, start with the CPR. Before starting with the CPR, position yourself and call or ask the bystander, call for 911 help, or you can shout for the help also. Help, help, I need your help, and immediately start with the CPR. For starting of the CPR, you should locate the sternum of the patient. Just imagine this center part of the chest. Okay, na? Draw a line and pinpoint it and just place your dominant hand. Interlace your fingers of non-dominant hand like this. Position yourself correctly and start the CPR. Okay, na? Make sure that person should be lied on a flat surface. The person should be lied on a flat surface. In the case of hospital setting, this is a basic life support. In the case of hospital setting, in the case of advanced life support, the patient who are there on ventilators are there on the air bed, water bed. In the case of air bed, we have to remove the entire air of the air bed. In the case of water bed, you can remove the water or you can remove the entire mattress. So that we have to do. Why is that so? Because it can create a hindrance while giving the compressions. Okay, the patient has to be there on a flat surface, the patient is positioned properly. You have to perform CPR till the medical help arrives. So start for the CPR. What I did from very first, I shake the patient's shoulder, no response. Look, listen and feel, no response. I have told the bystander to call for help 99911, and then I have started with the CPR. First initiating the CPR, central, we have to locate the sternum. We have to place our hand, this lower palm, this should stick to this portion. Interlace your other hand fingers, that's not dominant hand. Like this, position yourself and start CPR. And while giving the CPR, you should count. Your shoulders will be aligned with the patient's body. Your hand should be straight. Your elbow should be straight. Elbow should not bend like this. Your elbow should be straight. And you are not putting the entire body weight over the patient. Just your shoulder weight. Just your hands should work on the patient. If you put the entire weight over the patient's body, there is a chance the ribs will fracture. Ribs will fracture. So in that case, position correctly. How many compressions you have to do? 100 to 120 compressions per minute, and 30 compressions you have to count. 30 compressions, why? Because to give the rescue breaths in between. 2 rescue breaths in between. So we will start. So after positioning, we have to count like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After giving this many compressions, we have to do a maneuver. What is that maneuver? That is head tilt and chin lift maneuver. Okay? To give the breath to the patient. Okay? Why this maneuver we have to do? Because this will keep the entire trachea straight. So whatever the blow you are giving to the patient, that blow will directly go into the patient's lungs. Okay? How we are going to do? We are going to do like this, a round opening, wide opening of the mouth. Okay? Done with the 1 oxygen. Again, ask the bystander to give the breaths. If it is not available, if the bystander is not there, you have to give the breaths. If the bystander is there, he should get the breath. While giving the rescue breaths, you have to stop the CPR. After giving the rescue breaths, again start with the CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay? So these many compressions we have to do. Check during compressions. Check for the patient face. Check for the patient extremities. If the patient hands are moving, if the patient legs are moving, or the patient is showing some signs of response, some signs of revival, you have to stop CPR at that time. Okay? You have to stop CPR at that time. If the patient is showing the symptoms, if the patient is showing the signs of the revival, you are going to leave the patient in a recovery position. Okay? Recovery position is nothing but at the lateral side, like this. Okay? At the lateral side, like this. Okay? The reason behind putting this patient on the lateral side, if the any vomitus is there, which is stuck in this throat, it should come outside. In the supine position, there is a chance the patient may aspirate. The patient may aspirate in this. 100 to 120 compressions are, you have to give accurately. You have to go depth 2 feet, 2 inches or 5 to 6 centimeters deep. You have to go. Your compression should be that much effective. Why the compression should be effective? Because manual compressions will squeeze the heart, and that particular heart will send the blood to the brain. You have, whenever the patient is collapsed, you have only 4 minutes. If you are not initiated the CPR, if you are not maintaining the effective compressions, the brain cells start to die after 4 minutes. Okay? The brain cells start to die after 4 minutes. So this is all about CPR, and this is all about basic life support. I hope you have understand.